And there's a growing problem of counterfeit medical devices and injectable treatments making their way into clinics here in the U.S.
Talking about things like fake Botox or fake Coolsculpting. They're posing real threats to patients. And joining us to talk about it is Dr. Sabrina Fabi, who's always got such interesting insight into things like this. Help us understand what we're talking about, who's using this, and where it's showing up.
Yeah, so, and something that I've even been approached with, many manufacturers will send emails to doctors or even letters to doctors stating that they can offer you a type of device like Coolsculpting or Ultherapy, or some of the transducers or like some of the cartridges that the device requires for multiple uses, that you can at least get that through them, like they're refurbished. And so you think that they're coming from a United States location, that they must be credible, but they're offered at a much discounted rate. So they go to the doctor first sometimes, and many doctors are tempted in order to be able to cut costs to purchase some of these devices or even products, and then they're able to pass those savings on to the patients, and so they seem like they're more affordable practices or spas. And so it's not that you're not really getting the real device or injectable.
And the key thing here, if you're not getting the real device, that means it hasn't been tested for safety, efficacy, that sort of thing.
Exactly. In the United States, the reason we don't have as many injectable fillers, for instance, where you have over 100 in Europe, is because they have to go through very rigorous testing in the United States. In our clinical practice, we do a lot of trials for these devices before they get even approved. So these patients are followed for a year, 2 years, even 5 years out from this injectable to ensure that it's safe as well as effective. And so if you engage in purchasing these devices, you can't first really give anyone any assurance about its efficacy, but you definitely can't even promise that it's going to be safe. And so in our practice, we've seen a lot of people coming in, especially from Mexico, because we are so close to the border, where the regulation is not held so tightly. And so patients have complications, their lips swell up after injections. They were told that it was maybe, let's say, Restylane, like this patient, and then it's not Restylane when we go to biopsy. It won't melt when we try to melt it with an anecdote, and it's in fact something else.
So do doctors know when it's not the real thing, and how do patients know this might not be the real thing? And what are some of like the real potential dangerous side effects?
Right, I mean, doctors should know better. I mean, there's only really, at this point in the United States, 4 large manufacturers of a neuromodulator or toxin, and there's only 4 to 5 really large manufacturers of fillers.
Do they ever pass it off as one of those 4, or they always come in a different name and you should know?
They will come in as that manufacturer, and it should come directly from that manufacturer. The same with the device. Now, these counterfeit devices, when they send a letter or an email, it will look like the device. They'll call it Ultherapy instead of Ultherapy. They'll say that they can freeze your fat, but not say the word Coolsculpting. And so they get around it, and it makes it sound like it's the actual device, but it's not.
They're not palming it off as like a counterfeit.
They're not.
Device.
No,
they're
not.
Having an alternative device.
It's an alternative device, or even posing it as like a cheaper version coming from Canada. Let's say that was a scandal happening with Botox about 4 years ago, and then doctors don't even know, and then patients don't even know either. Sometimes a doctor may know, and they're passing on the savings to the patient. Patients wonder, why is it half the price at the spa? And it's because you might not be really getting the real thing. And so as a consumer, things to look out for. Right. If it's too good to be true in pricing, it most likely is. You should get an idea of the range in pricing, and then kind of go with something in that ballpark, not something that's out of that ballpark. You can always check the manufacturer of the device, go on provider list, and see if that doctor has a record of having the device.
And if this still doesn't like hit people over the head, I mean, what are the actual risks we're talking about that can go terribly wrong with this?
Right, you saw the photo of that lip. That woman, you cannot get rid of that product in her lip. She's gonna have to live with that product in her lip like that. So it can deform your face. We recently saw someone who was gonna get married. Here she is, 1 month before her wedding. She was told this was Ultherapy, and it was done by a very reputable practitioner in Mexico, and it was not the device. And so if something is being offered at a home, in a basement, in a place where that person doesn't regularly practice, they're just coming by for 1 month, of offering their services, or a 1 week, offering of their services, those are kind of red flags. Because once you have scarring like this, it's very hard to get rid of. You can improve it, but it's hard to get rid of. And make sure that the person has an up-to-date medical license, perhaps. And so these are some good things to do. And then you can always check them out, American Society of Dermatologic Surgery, American Society of Plastic Surgery, to make sure that they are actually board certified dermatologists, plastic surgeons.
If it sounds too good to be true,
Yeah.
it probably is. Don't
With
take your
everything.
chances.
And do your research. Do your
right.
research. All right,
Yes.
Dr. Fabi, thank you.
Thank you, guys.
As always, appreciate it.
All right.